When it comes to treating cervical cancer, early detection is key. That's why the Community Cancer Institute in Clovis is helping patients detect cancer early and provide advanced treatment options for those battling a cancer diagnosis. Gynecologic oncology specialist Dr. Ashley Moon says cervical cancer can go undetected for years for some patients.
It does take a long time, especially those who are not immunocompromised, so they have healthy immune systems, and so it does take their bodies a couple of decades for the cervix cancer to actually become full-blown cancer.
This is why she said early detection is important.
It's really important to know about screening. So screening is really in the form of pap smears, which can be performed by OBGYNs, even primary care doctors, family medicine doctors. This is really the most important part of screening against precancer and cancer of the cervix.
When found early, cervical cancer can be treated with a combination of surgery and radiation or chemotherapy and radiation.
When we get into the later stage or advanced stage cervix cancers, the treatments are no longer really surgery, but more so chemotherapy as well as plus or minus radiation. So we have treatment options, of course, earlier stage or more curative treatment options than later stage.
There is also a specialized type of hysterectomy that can be used to remove cancerous tissues.
Because cancer in general likes to go to the nearby areas, right? That's how it spreads. And so for cervix cancers, these early stage, the hysterectomy is a special type of radical hysterectomy that is only really performed by gynecologic oncologists because it is a bit more specialized and needing more expertise.
Symptoms associated with cervical cancer can include unexplained pelvic pain and oftentimes bleeding following intercourse.
Any of these signs happen and they're very new, or even if they're not new, they've been going on for months to years, to definitely bring it up to their doctors or even to any healthcare providers, and so then he or she could then refer the patient to the specialized physician.
But the most important thing to remember, Moon said, early detection through women's wellness exams.
Cervix cancer is definitely the only gynecologic cancer, one of the few cancers in general where we can prevent it. We knowingly have a test that can detect it, as well as detect it before it becomes cancer from a pre-cancer. To really go and get their women's exam or exam in general, just to get their pap smears done. That's the first thing.
For patients who've been diagnosed with cervical cancer, the diagnosis and doctor visits can be stressful.
One thing, with cancer treatment and living with cancer and is that you need to see many different doctors. It's all, many different disciplines. And one hurdle can be a fragmentation of care, where you're seeing one doctor here, another doctor 2 hours away, another doctor an hour away. And that's really inconvenient for both the patient as well as family members who are helping take care of him or her, the patient.
But the Community Cancer Institute offers a variety of services in one centralized location, making it easier for patients battling the disease.
So the fact we have all of the specialists here at one place is easy for the patient and their families to see all the necessary doctors and get all the necessary treatments in one place.